It's okay.
I'm going just when I say go, you go. One, two, three, go.
Hello, Robin. I'm Dr. Ibrahim. I'm one of the psychiatric doctors working here today. How are you doing?
I'm fine.
Oh, thanks for seeing me, Robin. I understand, and I understand you've been here for some time. You're posting, am I correct?
I want to know more about the condition of Miss Anne. She's losing weight. She doesn't want to eat. And I would like to know exactly what is her case because I would like just to have an idea about her condition.
Okay, and that's exactly why I'm here to see how we can have a discussion around Miss N's condition and how we can best support her. But before I go into explaining, what's going on with Miss N, I just want to have your understanding of what you think is going on with her,
Well, I
Robin.
don't know. What I know that she is losing weight. She doesn't want to eat. And I'm
Mm,
here to understand more about her condition.
right, and yeah, glad to know that you are aware of the fact that she's been losing weight. So to add up
Yes.
to what you already know about Miss N's condition, it does seem like she's been losing weight because she has this preoccupation about an ideal weight she's intending to attain. So for this reason, she's been engaging in some behaviors. To the best of my knowledge, and according to the notes, it does seem like she's been exercising excessively. She's been skipping her meals just to restrict her diet. Are you aware of this?
Well, I hope that she is dieting. Isn't she is dieting? So why she is in the hospital?
Yeah, and this has been happening for several months now. So it does really point to the fact that she may be having a condition we refer to as anorexia nervosa. I don't know. Has anybody mentioned this to you, Robin?
You know what is anorexia nervosa?
I'm glad you've asked this question, and it's a mental health condition where a person is so preoccupied about his weight. And looking at Miss N, as I said, she's had an ideal weight, and for this reason, she's been exercising excessively and has been skipping meals. Some people could go the extra length of using medications, just to lose weight as well. Does it make sense?
Yes, yes, yes. But well, I think that she is dieting. Isn't this what happens in diet?
Well, yeah, people could, yeah, I see why you think she's dieting. Yeah, it could be she could be dieting, but going the extra length of skipping meals and restricting what she eats, also exercising excessively, and these usually is not in keeping with people who just diet to maintain their weight. So this also could lead to other things that could have some consequences
I see, I see.
to
So
our health.
what could be the
Right.
reason for this anorexia?
Oh, so actually for anorexia nervosa, a particular cause is not known, but there could be a lot of factors that when they come together could lead to a person having this condition. So usually it could run in families. And from the notes, I do gather that Miss N has a sister who's been struggling with this condition as well. Are you aware of this?
No, no, I don't know about this.
Okay. Right. So she has having a family member who's struggling with something similar could put a person at an increased risk of having this condition. Yeah. So there could be
Okay.
other things like the personality. I do understand that Miss N has a perfectionist personality as well. When you put this together, and stressful life events could predispose the person having anorexia. Does it make sense, Robin?
Yes, is it a serious condition, though?
Sorry?
Is it serious?
Well, it's serious condition, and it's quite serious because um, a person that has no time could have various comorbid complications that could result. So, for example, for her not eating could lead to her blood sugar, getting so low, and she could be predisposed to having low blood sugar. Okay, so on the other spectrum, she could also have other problems with the heart, the kidneys, and we don't want this to happen. And that's why we need to, treat as appropriate. Does it make sense, Robin?
Yeah. So, well, do you feel that she might get better?
Well, this would depend on a number of factors. I understand that it could when you bring all these factors together, could determine the outcome of the condition. So when she goes into, say, therapy, for example, looking at the social support, and if there are any associated or comorbid conditions when treated, could significantly improve the outcome of the condition. And does it answer your question, Robin? And would you have any other questions?
Well, how are you going to help her?
Well, there are a number of things we could explore to see that she gets better. Usually, we could explore talking therapies, we could explore her social support, and also, very less commonly exploring medications for any comorbid conditions. But really, is there anyone you want me to start with?
1 minute remaining. No, just take time.
Okay. So yeah, we could start with anyone, but usually because this is more of it could depending on what we're dealing with, a talking therapy for eating disorders could help alleviate the condition, and that's because talking therapies like CBT. I don't know if you've heard of this before.
Let's see.
Yeah, so it helps in linking thoughts, emotions, and our actions, and together we could help, correct any. We could help deal with any thoughts of preoccupation with her weight, and to make her feel better on the long term. So not to worry, Robin. Yeah, would you have any other questions for me?
No, thank you.
Yeah, so I'm going to leave you, if it's okay, I'm going to leave you with a a link where you could get some more information about anorexia, and I'm happy to arrange another meeting to see how we can best support Miss N.
Okay.
Okay.
Okay. So how do you feel about what you did? Time.
Thanks for seeing me.
How do you feel about what you did, doctor? Well, you tried your best, but there are considerable mistakes, considerable amount of.
Okay. Yeah, I think I tried to
give him your feedback, please, doctors, in the chat
Sorry?
section. I'm saying give him your feedback.
Okay. I said I tried to follow the lead of the role player as much as I could. But at some point it felt like I was giving more information that I was supposed to. And maybe I should have asked of the role players thoughts as to how to best support her, because yeah, that's the way I thought.
Well, first of all, I didn't feel that you are very assertive. I feel that you are not very self-confident, hectic. It seems that you did not prepare well for this station, to be honest with you. What do you know when you ask the student nurse? He doesn't know anything, actually. And as I told you, pay attention to the information, because he's not a caregiver, he's not a family member, he's a student nurse, he's a student medical doctor, he doesn't know anything. He expects from you to tell him more about the condition. This was a waste of time, actually. Difference between the diet and the anorexia is a very important question. In diet, there is a particular body image in which the patient or the person prefers. It's not an open invitation to lose weight. The patient does not go through medical complications. Okay, it does not include disturbed body image, which is persistent despite the improvement of the body. When I ask you, is it serious condition? Well, this particular question, if you don't answer it properly, most probably you will not pass, because this is a fatal condition. 5% of the patients will not pass the anorexia problem. We will go through the percentages of the patients who have problems and so on. Side effects, unfortunately, again, the side effects, you should elaborate more about the side effects. And when I ask you, do you feel that she might get better? This is a question which you are going to encounter in in all the psychiatric disorders. This is a question about the prognostic factors. So you should know how to assess the prognosis, to know how to talk about the prognostic factors because they are stable in all of the stations of the, or all the psychiatric conditions, as to say. So let's see how we can do this station. As I said, you are going to talk to the student nurse, and you should, in the very first beginning, understand what is expected from you in this station. You are going to do three things. You are going to explain the diagnosis. You must know the etiological factors and inform him about this etiological factors and the treatment plan. Okay, so the first thing you should do when you see a management plan, you must expect that you will have some sort of stressful time issue because the management plan incorporates or management task that you are going to talk. It's not like the history taking or the mental state examination. In the mental state examination, you are posing question and that's it. But in the management plan, you are going to talk. So the way you are talking makes a big difference in the time management. Some candidates use very long sentences, or particularly if they are IMGs, and sometimes they are pausing in the middle of the sentence. They have this stuttering way of talking. If you are going to lose 1 second in every sentence, at the end of the station, you are going to lose not less than 30 seconds, which you definitely need at the end of the station. So pay attention in the management station, you must be very fluent. Try to use short sentences as much as possible and try not to lose time by being disorganized. So your introduction could have been better, okay? Directly start the task. Hello, Mr. X. I'm Dr. X from the Mental Health Unit. I've gathered from the notes that he wanted to discuss with one of our team members the condition of Miss X, and I'm here to help you. Okay? So this is how you start the station. Try to be very assertive and go directly to start the task. I felt that you were not, I think you were wondering how to start the station. This is not a very good place to be hectic because it is in the very first beginning of the station where the impressions persist. You know, first impressions persist. So you are going to give this impression that you are not very self-confident. This is not something good. He will ask you what is wrong with Mr. X. Mrs. X, you are going to explain what is the anorexia nervosa. And unfortunately, your explanation was very defective. You did not mention the 15% below. They did not mention the changes and means that you mentioned also induced self-weight loss and body image distortion. That's it. It was very defective, actually. Okay, is it common? This is one of the questions also. As far as the NHS sources, it is 1 every 100 lady. While in the males, merely it is the third prevalence, so it is 1 in 350. What are the causes of anorexia? Also, this is a very important question because it targets the points which you should cover in the task, the etiological factors. So you have the familial, the psychological, the childhood, and the brain chemicals. Okay, social. So these are the biopsychosocial. Familial, having a family member who has anorexia coming from a family which is over-controlling and over-involving. And there are some psychological factors like perfectionistic personality and obsessive traits, and some factors like the childhood chronic illnesses and bullying because of the thinness or the body weight, and also brain chemicals. And very important, the social praising of thinness, because nowadays the girls and ladies see themselves beautiful only if they are very thin. Okay? Is it a serious disorder? This is a very quite important question, and you must mention the outcome of this disorder. Yeah, 50% will recover, 30% will be partially recovered, 20% will have chronic illness, and 5% the mortality. These statistics numbers are very important, Dr. Ibrahim. Okay, unfortunately, you didn't mention them, and you did not mention or elaborate in depth the other side effects like osteoporosis, the infertility, etc. Is it going to get better? This is a question about the prognostic factors. And the answer is typical for most of the psychiatric diagnoses. So prognostic factors are stable, that the factors which favor the good outcome, like age of onset, absence of family eating disorders, early engagement in treatment, absence of, etc. So you can see this paragraph. You can just find tuning of this paragraph will make it suitable for all the psychiatric disorders, okay? Unfortunately, this was not a very good answer from your side. How can I help her, or how can you help her? This is the best way or best place in which you are going to put your formulation, and formulation is a very important skill. It is very simple, but it is expected from you to know how to formulate. Formulation is simply pinpointing the most important points in the patient story, which you are going to work on in your management plan. So when you talk about the formulation, first line is talking about the main psychiatric disorder, then the complication, then the level of risk. So this is the first line. Second line, the background information, which you know, or you need to know. So if there is an important information in the psychological or biological or level of risk or social axes, you must mention them in the background, or if there is an important information missing in these axes, you must also mention that we need to know that. It's so in this case, all this in background that of having no past psychiatric history. However, we need to know more about the psychological condition and social life. So this is how we talk about the formulation. Simply, there are many ways by which you do the formulation, but for the sake of the 7 minutes of the exam, this will be fair enough. Now, any other points which you like discuss? Okay, the management. Now, when you reach at the point of management, pay attention to Ibrahim and all the candidates. When you reach this point in which you are going to talk about how effectively you are going to implement your management plan, most probably you will not have more than 90 seconds, maximum 90 seconds. So you must be very, very organized and try to cover the most important points in the management, which will help you to pass. So the first important point which you must do and will help you to score in the mark sheet is what are you going to do, Dr. Ibrahim, you yourself, and where the patient is going to be treated. Because when you say, I'm going to see Ms. X again, I'm going to explain the diagnosis and address her concern, this helps you to score the point number 4, okay, which talks about the paying attention to the patient's physical and health view. So those who say that I'm going to talk to my patient and explain the management plan and address the concern with thorough physical risk assessment, they are going to score for themselves this point, okay? Are you with me, Dr. Ibrahim?
Yes, Dr. Hossam.
Okay. So
All the feedbacks have been noted.
Well, the first thing when you start talking about the management plan is what are you going to do and where the patient is going to be treated, because where the patient is going to be treated is very important according to the level of risk. So we know that this is a highly risk condition, but at the same time, there is a chance for her to be treated at home. So how can we talk about this? So we can say Miss X will be treated at home and followed up regularly by a nurse. However, if there are any concerns about her safety, the admission to the hospital can be considered. So you are going to talk to your patient, and your patient is going to be treated at home mainly. However, because of the high risk because of the medical complications and many other issues, the admission to the hospital might be considered. Okay, so far? Okay, so now the second point you are going to talk about is investigations. So the first point, as we said, what are you going to do, where the patient is going to be treated, and the investigations. And most probably this line is a stable and a cliche in all the stations. So you need to do some blood tests and mention specifically what blood tests which you like to do. Okay, CBC, liver function test, etc. Don't make it open that she needs to do some blood tests. There are hundreds of blood tests. What exactly which you are talking about? Now, you must mention in the point number 3 this important sentence. There will be a team who will cover all her needs physically, psychologically, and socially, because this will give the examiner that you are a psychiatrist who is trying to address all the axes or all the aspects of the patient's life, psychologically, socially, and physically. So this sentence is very important. There will be a team who will cover all her needs physically, psychologically, and socially. And under physically, you're going to talk a little bit. Under psychologically, you're going to talk a little bit, as well as under the socially. So under the physically, which is very important in this station because basically it has a lot of medical complications, you must liaise with the GP and the gynecologist. Very important. Okay, as well as the involvement of the dietitian. Okay, doctor. So I don't think that anyone will pass without addressing the physical problems of the patient in the management plan. You did not talk about the dietitian, you did not talk about the gynecologist, okay? And the involvement of the physician is very important also. Are with me, Dr. Ibrahim? Now,
Yes, doctor,
psychologically,
I'm with you.
backbone of the management plan is the talking therapy. And here you must mention that it might be a lengthy talking therapy up to 12 months. Very important. Mainly can be cognitive analytic or CBT or interpersonal and family therapy. So you have different types. If you want to mention them, one or two, no problem, but you must mention that it is the backbone of management and it can be lengthy. Now, socially is very important because we need to do family psychoeducation, and the social services can help to ensure that the treatment duration will not affect her education or work. And then terminate. As you can see, there are a lot of things to be covered in the anorexia nervosa station. It is not an easy station, and the passing rate in these types of stations is high because most of the candidates miss. Definitely, they miss something because, as you can see, a lot of things to be covered in this stage. Thank you so much, Dr. Ibrahim. Who would like to go next?
I'm happy to
Thanks,
go
Dr.
next.
Osam, for the feedback. Much appreciated.
Who would like to go next?
Me, doctor. Hi.
Yes, hello, Doctor.
Hi.
Dr. Lina?
Dr. Leap here.
Yes, so what is your station, Doctor?
So I have two stations today. I prefer to start with that scan with lower body dementia.
Okay. These doctors give the doctors who do the stations a feedback in the chat section. It's very helpful even for me. Okay.
Okay. Good. So, Dr. Hussam, it's mainly about to deliver the diagnosis and to counsel the caregiver about the management plan, isn't it?
Yes, yes, yes.
Okay. So I'm ready, inshallah.
Inshallah. Let's say that my name is Mrs. White. My father is Mr. White. Okay.
Mr. White.
Yes, and I'm Mrs. White.
Mrs. White. Okay. So
Just give me just a minute, just raise the voice. When I say go, please. One, two, three, go.
hi, Mrs. White. This is Dr. Lina Taha from Psych Department.
Well, I don't want to be rude, doctor. I don't know why I'm talking to psychiatrist. I thought that I'm going to follow up with the neurologist. We have been following up with the neurologist for 6 months. I don't know why I'm talking to you.
I understand your frustration, but just I want to reassure you that we are here to put things on the table together, and we can discuss together how we can provide the appropriate management for your father. Are you happy to discuss this today?
Well, I hope that this will sort out the problem, because I feel that there are a lot of things which I need to understand about my father's condition.
So I'm happy, Mrs. White, today to answer for your all questions, to address your all concerns, if you are happy with that.
Well, I would like now to know the diagnosis of my father, because as far as I know, he is having a Parkinson's disorder. Now they say, no, he's not having Parkinson. You should follow up with the psychiatrist.
I understand. So your father has a diagnosis of Parkinson's disease. For how long now, Mrs. White?
It has been going on for 6 months now.
6 months. So, and what are your main concerns? So, he has difficulties, has experienced difficulties with what in particular?
He has been having a problem with his movement, being very slow, and his face become very masked. We checked this, and they said that he has Parkinson's disease.
I understand your concern. It must be difficult, I know. So, and did he start any medication regarding his Parkinsonism?
Yeah, he's taking medication with the neurologist. He's following up with with the neurologist, actually.
And have you seen any improvement regarding his movement?
Yes, his movement has improved, but he became very forgetful lately. And the neurologist asked for this DAT scan. I don't know what is this DAT scan.
So anybody explained for you what is DAT scan?
No, I'm here to understand more. What is DAT scan? What is the result of this DAT scan? What is the diagnosis?
I understand. So DAT scan mainly, we do an image for the brain to navigate or to, track a substance which is responsible for 3 main things: sleeping cycle, for the alertness and memory and movement. So we do this investigation or this image to see, the distribution of this substance called dopamine. I don't want you to be confused about the names. I will try to do it simple as possible. I am clear till now?
Well, not very clear, actually.
So we will see this dopamine, like the navigation in the car. We will see the dopamine the distribution in the brain. So if in areas in the brain that responsible for what I mentioned for you, so if low amount or no amount of dopamine, so this is highly suggestive for what we call Lewy body dementia. Am I clear so far?
No, well, I didn't understand, but he said that he has Lewy body dementia. So what is this Lewy body dementia?
So you mentioned that your father now recently started to have memory problem. Anything like, he started to see things that nobody other than him see these things?
What?
I mean, so you mentioned that he started to have some difficulties with his memory. So anything like, beside his memory problem, like see things nobody rather than him see these objects or things?
No, no one else is seeing these things but him, and he is very forgetful, actually.
Forgetful. And what about his alertness? Do you feel that in some time among the day he is alert, and at some time he seems like confused?
Yeah, yes, exactly.
So this is, highly suggestive for what we call Lewy body dementia. So it's type of dementia mainly affecting the movement, the memory, and the sleep cycle. How is he sleeping currently?
He is not sleeping well, actually.
And this is something has facing difficulties for how long now with sleeping?
Well, I think it's now about 1 month.
1 month. So this is something new. So he has a diagnosis of Parkinson disease, but as well, he may have some other difficulties. So we are here to provide, the clarification of this and to discuss how can we manage this appropriately. Am I clear till now?
Well, actually, so why it is not Parkinson disorder, doctor?
I understand. So he has a Parkinson's disease. This will not prevent to have another illnesses. He may got infection. He might got, another diseases. One of these diseases is lower body dementia. So the difficulties that, appeared currently. So we should address these difficulties.
I see. Is it common problem in this Lewy body dementia?
So, it's not, widely common, but it could, with Parkinson patients.
1 minute remaining.
They have potentiality to develop this condition.
Is it curable, doctor?
So it's highly manageable. So we can provide some medication. We will try to avoid antipsychotics medication, not to worsen the condition. And on the other side, we can provide the psychological support for your father and for you as a family member, because you are the carer of your father. And he's lucky, by the way, to have a very caring daughter like you. So, and we will give you a social support. We have some leaflets to provide for you to read more about Lewy body dementia and the management plan. And I am happy to sit with you more and more to discuss any other concerns regarding your father condition. Are you happy with that?
Okay, thank you, doctor. Thank you so much, time. How do you feel about what you did?
I think, Dr. Hussam, I should provide more time for the management plan. I was preparing myself to explain more management plan, but, the time was very restrictive. The caregiver was reluctant and was difficult, but I have to prepare myself to deal with every case. So I'm not happy, I need to improve myself, yes.
Okay, so please give her some feedback. Now, use some jargon. Your explanation was lacking, actually. You started your task very late. It's not a history-taking task, doctor. This is not a history-taking task.
Mm-hmm.
You are going to explain the diagnosis. You are going to address her concerns and do your management plan. There's a big difference between this and the history-taking task. You started to ask me about the onset, when did this start and when did that start. These are wasting time questions, actually.
Mm-hmm.
Is it curable? This is a question which challenges your ability to deliver bad news, because unfortunately this is an uncurable disorder. It is progressive. All what we can do is that we can improve the quality of the life of the patient and help the family in taking care of him.
Mm-hmm.
But you must mention that it is progressive, and usually the duration from the diagnosis to the mortality between 4 to 8 years. Why it is not Parkinson? This answer was very defective. Is it common? Again, you missed the statistical figures related to this question. You will not talk about the management actually in any way. So let's see how we can do this in.
Perfect.
So let's just to refresh our memory by what is required from us in this station. This is a management station. Okay, clarify the diagnosis, explain the treatment options of this condition. Okay, and while there is some sort of dialogue between you and the lady, she might ask you some questions related to the outcome, the statistics. Okay, these are questions which you might expect, but still your main target is to explain the diagnosis and explain the treatment option. Okay, so let's see according to the notes. This is your management plan. According to this task, it's very obvious that you are going when the task is address the concerns, it is a management plan. Clarify diagnosis and treatment option. This is the management plan, and this should be your management plan point. Okay. Now, she is going to ask you in the beginning why she is talking to a psychiatrist. You must explain to her that the condition of her father required further investigations, and according to these investigations, a new diagnosis is set. You would like to discuss with her the results of the investigations and the new diagnosis. Now, the investigation is called DAD scan. Simply say that it's brain imaging, and according to this type of brain imaging, we have detected some proteins in the brain, which we call Lewy body. And according to the clinical picture and the DAD scan, most probably your father is suffering from Lewy body dementia. You went through lengthy talking about many things. Actually, I was confused. This is try to be as simple as possible. Try to be focused as much as possible, because you only have 7 minutes. You don't have the luxury of talking like in your OPD. You only have 7 minutes. Okay. Try to have a look at how we can start the station. Try to take screenshots. If you're not going to buy notes, no problem. You can take screenshots. Okay. How to start this station, how to explain the diagnosis, and how to explain the DAD scan rapidly without losing much of time. Why it is not Parkinson disorder? As a matter of fact, the Lewy body dementia is a combination of Parkinson in addition to dementia. So there are a lot of common issues between the Parkinson's disease and Lewy body dementia. So in order to differentiate, usually the memory problems start in Parkinson's disease after 12 months, and they are not very strong like in Lewy body dementia, which start earlier and they are stronger. But both of them have the symptoms of Parkinson's disease in common. Okay, so this is how you answer, because memory problems appeared few months after the onset. Most probably in Parkinson's disorder, the memory problems start after 12 months and maybe later also. Is it common? About 7% of the patients who are suffering from dementia have Lewy body dementia. Again, is it curable? This question, as I said, requires from you some communication skills, because this is how you deliver a bad news. So you must use the appropriate tone and the appropriate word. Unfortunately, the dementia is a progressively deteriorating disorder. The lifetime span after the diagnosis is about 4 to 8 years. We can help the patient to improve the quality of life, decrease the rate of deterioration, and also help the caregivers in taking care of the patient. This is how you talk about, is it curable? Okay, don't say the blunt figures without any emotional support in what you are saying. Now, very important before setting any plan for any patient, that you understand the condition of this particular patient. Doctors, this is a clinical situation for this particular patient. It's not about talking about the management or the philosophy of treatment of Lewy body dementia in general. No, you have a particular patient who have distinctive physical condition, you have distinctive social condition, you have psychological condition, and there could be also some risk factors associated with this particular patient. So you must understand more about this particular patient by asking some questions related to the biopsychosocial domains and the level of risk, okay, before setting any management plan. Now, very important, doctors, to know how to do the formulation. Again, the formulation is simply 2 lines. In the first line, you are going to talk about the main psychiatric diagnosis, complication if they are present, and the level of risk. So this is the first line. The second line is the background of the important information which you know or you need to know in the biopsychosocial domains and the level of risk. Okay, so I'm not going to talk about how to do information formulation details, but it is a very simple skill. I'm sure that when you understand how to do it, you will not have any problem with it. But it is very important. Why it is important? Because you see in the mark sheet, the first point is going to be scored for you is about the formulation. Are you able to pinpoint the most important points in the patient story, which you are going to work on in your management plan? Do you know how to do this or no? Definitely, it is not a difficult skill, but it needs some training and understanding how to do it. And I will share with you a simple video clip about how to do your formulation. And when you know how to do it, you will not find it difficult at any level. But you must know how to do it, and the best place to say your formulation is immediately before talking about the management. Now, again, when you reach the management plan, most probably you will have only 90 seconds if you are very clever and you are very, very organized in your time management. Most probably you will not have more than 90 seconds. So you must be very organized when you talk about the management plan in order to cover most of the important points. So the first point which you are going to talk about, Dr. Lina, is what are you going to do, doctor, and where the patient is going to be treated? What are you going to do? So we want to talk to your patient to explain to him the diagnosis, do thorough physical and risk assessment as well as mental state assessment. Ideally, this patient should be followed at home and in the memory clinic. However, if there is high risk or not having enough support in the at home, the admission in nursing home can be considered. Okay, very important to have this start, not only because this will help you to score the point number 4, which is spared for those who talk to their patients, but also it will give an impression to the examiner that you are different. We are not talking in general about the philosophy of treatment of Lewy body dementia. You are talking to your patient to explain the diagnosis and the risk is concerned, etc. And you understand that there is an appropriate placement for your patient, whether at home or at clinic or in a nursing home or in the medical hospital. So where the patient is going to be treated and what are you going to be, Dr. Lina, is the very first important point which you should talk about. Number 2, investigation. This is an elderly man. You are going to start for him some medication. As we said, start with talking about the investigation. It is a standard sentence, CBC, etc., liver function test, but very important to talk about heart tracing. Okay? Are you with me, doctor?
Yes, and you were very informative, Dr. Hussam.
Okay, now the third point, which we always say, which will show that you are a holistic doctor in the management of your patient, is this important sentence. There will be a team who will take care of your patient physically, psychologically, and socially. This is a very important sentence in the management because this gives an impression that you understand that there are different facets in the management and your patient has different needs on the psychological level, social level, and the physical level. Physically, very important here because you must liaise with the neurologist because this man is following with the neurologist, and the Lewy body dementia, as I said, is a combination between Parkinson's disease in addition to dementia. So you must liaise with your neurologist, okay? And also with the GP because the Lewy body dementia patients are more prone to develop hypertension. Okay? The backbone, psychologically, the backbone of the treatment is the correcting the chemical imbalance, okay? And the main treatment here is rivastigmine. But pay attention, when you talk about the medications for any dementia, you must sort out the important problem of forgetfulness. So this man will forget his medications. So you must immediately talk about the application of these medications either by patches or the dosette box. You're using dosette box. Okay? So don't talk about rivastigmine without mentioning that you will help your patient with either applying this medication in the form of patches or giving him dosette box. Now, social is very important, this part of the management, because you need to do care assessment. Lewy body dementia patients are very independent. They need a lot of care. So there must be some sort of care assessment. Okay. And there might be a care package. Very important to talk about the occupational therapist role, which you did not mention. And there'll be a psychiatric nurse who will follow him up. Okay. As you can see, a lot of points to be covered in this management of Lewy body dementia. Unfortunately, again, because they are very important points and missing them might cause you not to pass a lot of points. So the passing rate in this station also is not. Thank you so much. I hope that you found it helpful. Who would
Very
like to go
helpful.
next? Okay.
Thank you, Dr. Hussam.
Okay, who would like to go next? Let's see the feedback. Yeah.
Dr. Hussam, I think I have another statement I can do.
Could be better. Well, Ibrahim Musa is your friend. If you have any questions, please write them. Okay, write them in the chat section. Okay. Who would like to go next?
I can do the next one. Okay.
If someone else, we can give him the chance. Anyone else other than Dr. Ibrahim?
Yeah.
Okay, all right. Because I have to
Sandra, I think there is Dr. Sandra, I think.
Yeah.
Okay. Okay, Dr. Sandra. Okay, so what is your station, Dr. Sandra?
Hypochondriasis.
I cannot see you. If you prefer to close your cam, no problem.
Yes, I've got my baby here, so if that's
okay. No problem.
Thank you. My station is hypochondriasis.
Hypochondriasis. Take your time, please.
Okay. I think I'm ready.
Okay. We'll start now when I say go. Let's say that my name is Mrs. Brown. My husband is Mr. Brown. Okay. 1, 2, 3, go.
Hi, Mrs. Brown. I'm Dr. Fredrin, one of the doctors, one of the psychiatrists to the team here.
Well, I don't want to be rude, but I'm wondering why am I talking to a psychiatrist? I'm going to talk to a neurologist. We need to do this this type of scanning to the brain for my husband.
Yeah, I understand your confusion, but the neurologist had referred your husband to come see us because sometimes we consult with our colleagues to just be sure we're supporting your husband in the right way possible. But I'm here to walk you through everything that we've talked about, and
So if he is not having this any physical problem, so why he is having these headaches?
well, yes, I'm not sure what you know so far about your husband's condition.
Well, he's having these headaches because he thinks that he has brain tumor and he complains a lot from this headache. We did a lot of tests and we need to do this MRI, which will help us to detect the presence of any tumors.
Yeah. Yeah. All what you said is correct. And so far, have they shared any of the results with you or your husband?
Well, I don't know anything about the results except that all the results came normal. That's it before, but he needs to know more about his condition with this MRI. I hope that you give us the permission to do this.
Yeah. So I've spoken with your husband and I've had a look at the neurologist assessment. So your husband has been having these headaches, but we've not been able to find any physical cause for it, even though it's been causing him a lot of anxiety. So when this happens, in a situation like this, the neurologist referred to us to see what we can do. And I've spoken to your husband. We've gone through a whole lot of questions together. And I think your husband has a diagnosis of hypochondriasis. I know it's a big sounding word, but do you have any idea what this is?
No, what is this problem?
So it's just what it just means is what we call an illness anxiety disorder. So it means that some people, like in your husband's situation, they just have this intense fear that they're going to or believe that they have this illness, even though every other thing says the contrary, but they just believe it, and that's what manifests in the headaches they have or in the symptoms that they're having.
So do you mean that he is faking these symptoms?
Oh, absolutely not. He's not faking it. So because even though there's no physical health cause for the for what he's having, in his mind, okay, that's I think the best way to put it is like our mind and our body is linked. For instance, I'm not sure if it happens to you, but sometimes when you're maybe embarrassed, you blush. It's not because there's a physical health why cause why there's a physical reason why you're doing that. It's just because your mind has felt that way. And that's what's happening to your husband. So it thinks in his head, it thinks that, oh, I've got this condition. And then his body now presents as though he's having it. So he's definitely not faking it.
I see, I see. So what could be the reason for this problem?
Well, that's a valid question. There's really no one specific reason. We just noticed that there are certain things that somebody has gone through or they're exposed to that might make them more vulnerable to it. For instance, maybe where he was growing up, they were health conscious family, maybe a family that pays attention to their health a lot. Or maybe there's a family member or close um, relative or somebody he knows that's had this kind of condition and then he just feels that way.
Well,
Is that
I think that he would be better if you allowed him to do this MRI. Is it possible, please, to do this MRI?
um, uh, because of what he's having, it's I will not advise that he does the MRI. And the reason I say so is because if the best the MRI we do is just reassure him for just maybe a short period, and he'll be back to having the anxiety again. So it's not a good fix for it, just like we're just giving him temporary
I
fixes for
see.
it.
So do
We
you
can
think
just
that he might get better?
we could support him to manage what is happening, and hopefully with the right support between medications, what we can do, what you can do, we can actually help him recover. So, and see that these things is having, they are actually not real. Just literally develop skills, reinforce the skills, and just really support him.
So how are you going to help him then?
Sorry, I didn't get your question.
How are you going to help him?
Okay, yes. So what your husband, so let me just give, let's just have a brief of all to discuss so far. So your husband has this diagnosis of health anxiety, even though we've not seen anything causing it. And because of that, I don't think has he got any other seen a psychiatrist like me in the past?
No, 1 minute remaining. No.
And what about work? Is it still working?
Well, actually, he's not working because they say that his headaches make him take a lot of sick leaves. So instead of terminating him, he just resigned.
Okay, I see. So there are a couple of things we can do. One of them is I'll write to the GP to make them understand that this is what is going to. So every time he goes to see them, they know this is what's on ground. We could also potentially give him a medication to help support him. And then there's a therapy we can refer him to, talking therapy, that can help him develop the skills to manage it going forward. And there are certain things you can also do. Do you want me to tell you?
Yes, yes, please. How we can help him?
So whenever he talks to you about it, you can validate the fact that he's feeling that way, but not tell him that, oh, not agree with the fact that he's having these headaches as a result of a physical health concern. And we could also probably get him sick leave off work so that he has time to recover completely.
Time. How do you feel about what you did?
I don't know, Dr. Hussein. I
Well,
think
it seems that you're an experienced doctor, but please pay attention that the way you talk in the class is a bit different than the way you talk in the real world, because as you can see in the task, you only have 7 minutes. You don't have the luxury of talking and explaining and so on. You must be very focused. Try to use short sentences as much as possible. Try to
okay,
target the task as much as possible. The
okay,
7 minutes is a challenge. It is a challenge, not easy, but it is doable. With practice, you can adjust your performance in 7 minutes. I don't think that you have any language barrier, but the way you are talking seems that you are a bit of, a compassionate person who likes to talk with her patients and explain more. But pay attention that this is not feasible in the cost. That's why you finished even before starting talking about the management. You don't talk about the management at all. Okay, so let's see how we can do this station. Uh, so give me one. Okay. Okay. In the beginning of the session, you are going to meet a defensive lady who is not happy that she is talking to someone else other than the neurologist who is supposed to permit the MRI. Okay. So why I'm talking to a psychiatrist, you address this question in a good way. Again. So and your explanation was good. It could have been better but in the context that you should use shorter sentences. Is he faking symptoms? We can, this a question which the can struggle in. It's simply he genuinely believes that he's having a brain tumor, but this is because of his anxiety, not because of underlying medical problems. What could be the reason? This was a cleverly addressed chronic childhood illness raised in families which seeks medical service for insignificant physical symptoms, past history of psychiatric disorders, and chemical imbalance. Well, when she stress on you, that he needs to do an MRI, again, this is a situation which the candidates feel a bit difficult, but simply say that doing an unnecessary investigation can bring a temporary relief, okay? However, it is not recommended. Why it is not recommended? Because it emphasizes that the patient is sick, and later on it increases his anxiety. Okay, because why do the investigation if you don't feel that there could be something wrong? So he is doing this investigation, so this will emphasize this feeling that he is having something wrong. That's why the doctors ordered this MRI. So temporarily he might feel relief, but eventually he will end up having more anxiety. Is he going to get better? Again, doctors, this is a question to address the prognostic factors, a stable answer, factors which favor the good outcome, starting the treatment as early as possible, being cooperative with the management plan, good level of functioning before the illness, etc. This is a stable answer in all the psychiatric disorders when you are asked about if the patient is going to get better. Use this paragraph. That's it. I'm not going to go through details again. Now, before setting the information, as I said, you need to know more about your patient. You need to know exactly what could this particular patient need, not the management of hypochondritis. You are not giving a lecture about hypochondritis. There is a patient in your clinic who needs a particular management, so you need to know particular information in the level of the psychological issues and social issues and level of risk. Okay, so before setting your plan, you must understand more information about the psychological condition, social condition, and this. And you have been actually stumbled in this because you started talking about the formulation, and then you forgot that you don't know information about enough information about his background on the social and psychological level. On the physical level, this patient is already cleared. What you want to know more about his psychological level and social level, his level of stress or any risk. Okay. Again, the formulation is very simple. You are going to, in the first line, you are going to talk about the main psychiatric disorder, the complications, the level of risk. The second line, the background of the information which you know or you need to know in the biopsychosocial axis or the and the level of risk. Okay. Management, as we said, Dr. Sandra, the first thing is what are you going to do, doctor? You want to talk to your patient, definitely. You want to explain to him his diagnosis and address his concerns. As I said, this is not a fancy thing to do. This is a direct addressing of one of the points in the mark sheet, as I said before. Investigations, he might need some blood tests, not because the brain tumor, but you are going to put him on medications, so you must make sure that he is physically fit for these medications. And when you talk about the blood test, make sure that you directly or clearly say what type of blood test which you need to do. Okay, now, as we said, the sentence of there will be a team will cover all his needs is a very important sentence. Always mention this sentence to give an impression that you are a candidate or a doctor who understand that the needs of the patient is not solely the medications. There are psychological and also the social needs. Psychologically, we said that psychological is talking therapy, okay? And the medications will be an antidepressant. And socially, you can add something like talking to social services to see how they can help him with his work or taking sick leave. That's it. Unfortunately, you did not cover any points in the management. You stopped in the point of formulation. And this is basically the way your conversation and the way you talk. Seems that you're a very compassionate person to talk and take your time in talking. And this is not how we do the course. Please pay attention to it. Thank you so much, Dr. Sandra. Very clever. I hope that you pay attention to what I've said and don't be frustrated from my feedback. Okay, who would like to go next? Hello, anyone who would like to go next?
I can go next.
Dr. Viv?
Yes, thank you.
Okay, so
I don't know.
okay.
I tried accessing the link you sent. I tried choosing the first station. I don't know if I was able to choose it or something. Yeah.
I don't know if
Yeah,
this is
that one, the one to explain to a student.
when what do you mean? What is your station?
I don't know. I can't open them, but I tried putting my name in the mania, the first station.
What is the
Trying to-
station which you have prepared? So definitely you have prepared something.
Okay, can I do the anorexia explain to the medical student?
We're not going. This would be a waste of time just to do a station without being prepared. Okay, you can read any of these stations which we have just in the checklist, and you can do it at the end of the session. But going through a station without being prepared, this will be a waste of time, please. And a lot of silly mistakes just because someone did not read the notes is a waste of time. So what you can do is that there are a lot, three, maybe how many other stations here? We have fair in pregnancy, elderly mania, um, lithium in pregnancy, metabolic syndrome. All these stations are available. Okay, you can write down the names of these stations and read any one. And maybe in 30 minutes, you will be ready to do your stations. Okay, you have metabolic
Dr. Sam,
syndrome.
which one is available now? I think I can do anyone. I've done these exams before,
Okay,
so I
let's
think
see. I think there is some one station which was not booked. Okay, let's see which station which was not booked.
I think it's the Lewy body hallucination that wasn't booked.
Yeah, there is another Lewy body dementia with hallucinations. Yes.
Okay, that's fine.
Okay, so Lewy body dementia with hallucinations. Okay, so we try to read them from the get through book or from my notes or from any other source, and definitely within 30 minutes you will be ready to do your station. You're welcome. So who would like to do the next station?
I can do it if it's okay.
Okay, what is your station, doctor?
Lithium with the pregnancy.
Okay, lithium. Okay, Dr. Besant, if nobody has booked the metabolic syndrome, do the metabolic syndrome. Dr. Besant is going to do metabolic syndrome.
I'm already putting my name, doctor.
Okay, no problem.
If she's happy to do it, I'm happy to wait. I'm okay with that. If Dr. Besant want to go to prove.
Well, it's up to her because it is her turn. You do it one station. So
Yes,
if you
yes,
are
I will
ready,
give her the chance. Yes.
if you are you ready, Dr. Besant, or you want to have your time to read the station?
No, I read it, doctor.
Okay, so
I'm
you
ready.
can do your station, Dr. Lina. Lithium in pregnancy. Dr. Lina, you are going to do your station.
So
Dr. Besant prefers to prepare.
okay. Okay. So just I need to read the station. Where is it?
I will put it, share it on. Don't tell me that you did not prepare your station.
Yeah, I prepared.
Very good. Okay, so here is your station. Please take it 4 minutes. Read the material, please.
It could be one page. Yes, that's perfect. Yeah.
I'm
Yes,
ready
Dr.
whenever you're ready, doctor. Okay.
Yes, إن شاء الله I'm ready. إن شاء الله توكلنا على الله.
توكلنا على الله. مفيش أحسن من التوكل على الله. Okay, let's say that my name is Mrs. Green.
Mrs. Pardon?
Mrs. Green, okay? Let's
Mrs.
choose
Green, okay.
different colors, not to just to make our tongue use.
Easy to remember, yeah.
Okay, different. No, sorry. Share this. Okay, I will set the timer. This is green. 1, 2, 3.
So it's about to discuss, you know, the pros and cons of lithium during the pregnancy.
No, it's over. It's over. You are in the station. I'm not going to tell you.
The station. I'm sorry. Okay, I'm sorry.
You should write down the task.
I write it. I write it actually.
I have to be
notes.
honest with you. This mistake is very common. They can do this because of anxiety. When they enter the station, they forget what is the task.
I already have,
Very
you know, some
common.
short
So
notes
they
with
give
me,
you a simple, a small note in your hand to write down the name of the patient, the task required, and any important information, and definitely your management plan or whatever you're going to do in the station. I'm not going to tell you what you should do, because your mistake you should pay for. Okay.
Okay. Sorry, Dr. Hussam.
No problem, because try to put you in the exam situation. Want to go?
Hi, Mr. Brown. This is Dr. Lina Taha from Psych Department. I'm here to provide appropriate help and support for you.
Well, thank you. I just want to know, well, if there is any chance that my wife get pregnant and can have a baby. I want to know our chances, doctor.
So congratulations, you want to establish a family and to have a new baby. This is a good news. And we are highly supportive to do, you know, the best of our best to do this in the appropriate way for you. So what are your main concern, you know?
Well, as far as I remember, they said to us she should not get pregnant as long as she's taking the medications. But this was 5 years ago. And I think she has been stable for 5 years, and we need to have our family.
It's good to hear that she's stable for 5 years now. And, you know, it's good to have a family, to be pregnant while using the medication, but we can use the appropriate medication during the pregnancy. So currently, what type of medication that she's using now?
Well, she's taking lithium and she's taking fluoxetine, and they said that these medications are not good for the baby.
So actually, you know, Mr. Brown, it's not advisable to use lithium during the pregnancy. According to the guidelines, you know, we prefer to use another medication, you know, alternative medication. And by the end of the day, it's your choice. But you know, I'm here to provide you the pros and cons, the advantages and disadvantages for every option that you will choose. Okay. So if you are happy to continue with lithium and fluoxetine, I understand that she's stable for this medication for long period, and you don't want to stop medication that you are happy with. But actually, you know, some studies mention that, you know, lithium has potential side effects for the baby, and fluoxetine as well. Am I clear so far?
So what are these side effects?
So, you know, during the development of the baby in the womb, so, you know, lithium has potential side effects for the heart of the baby.
I see.
And about fluoxetine, so maybe in the, you know, in the third part of the pregnancy, it may affect, you know, the progress normal progress of the lung. So it's again, it is a potential side effect.
So is it common to have these side effects?
Actually, no, regarding lithium, it's about 1 among 1,000 or 2,000. About fluoxetine, usually we prefer to use this group of medication for treatment of depression during the pregnancy, and it's lower, it is still there, but it's lower side effects, low potential side effects to develop this potential side effect.
I didn't understand what you're saying.
So I mean in fluoxetine, so we have potentiality to develop this side effects, but it's less common. It's
Yes.
almost rare, yes, rare side effect.
Okay.
So what do you want to know else about?
So if the risk is the same over the all over the pregnancy,
What do you mean?
is it the same risk for the lady to take the medication, or it differs according to the number of months of pregnancy?
So actually, we will do some investigations. Usually, we do some investigations, to monitor the lithium level. It depends, it depends, upon the adherence to the medication, the level of the lithium in the blood, the age of the mother, many factors. It's not just regarding a single factor.
But one of our friends has been taking lithium while pregnant, and she has a healthy child.
I understand. So as I mentioned, so it is 1 among 1,000 or 1 among 2,000 to develop these anomalies. So we have another 999 healthy births. Makes sense?
Yeah. I'm wondering what would be the solution. If she stops the lithium, she will relapse, and if she takes the lithium, she will not be pregnant because of the damage of the baby.
This is a very good question. I'm happy to answer you. So, if you decide to stop lithium, so we can do this gradually. We will not stop this suddenly, and we can add, alternatives like something we call quatabine. We can add olanzapine. So according to the guideline, they are more safe during the pregnancy, and they can control, the depression very well. What do you think about that?
Well, this would be helpful. So, well, I would like to know what could be the next step.
So I prefer to see Mrs. Green, so to discuss this with her as well. And besides
1 minute remaining.
Besides discussing the medication, so it's important to to give a maximum, part to the non-medical treatment, like talking therapy, or booking you for the talking therapy if you are happy with that. We call this CBT or interpersonal therapy. I am happy to explain this for you in another session. And the social support is very important. Your support as a husband is very important during this duration. And we are happy for you to answer any question, either for you or for Mrs. Green. Are you happy with that?
Okay.
So as I mentioned, we have medical part, we have social part, and we have psychological part. So all of this working together to address the issue.
Okay. Time.
Thank you so much. Do you have any question for me?
No, thank you. Time.
Thank you. Thank you.
How do you feel about what you did?
I'm so anxious. I feel that I'm really so anxious. This affects my
You are
performance.
very, very anxious person.
Yes. Stuttering, I have to control this issue.
Is it possible to go through stations that come in the last September? No, actually, we have here, Dr. Iman, a particular sequence to help the candidates to master one task at a time, because this will help them to pass. So we have the main 3 tasks: the history, the mental state, and the management tasks. When the candidates master these tasks, and in addition to the physical examination and the capacity formulation, I think they can do it by themselves. They can pass. So there is a particular logic behind the types of stations which we are offering. Now we are in the start of the management task, which is one of the most important tasks. Okay. Okay, so let's see how we can do this station, but there are a lot of considerable mistakes.
I know, yes, I
Go
know.
through all
Yes.
this. Now, what is the diagnosis of this patient, doctor?
So
What is the diagnosis?
she has resistant depression and difficulty barely treated, we know, with
Okay,
lithium
she has resistant depression. Okay, and the backbone of the treatment is fluoxetine, and lithium is to boost the effect of the depression of the fluoxetine. Okay, pay attention to this because it makes a difference in the management. Okay. The sequence of the pay attention that the diagnosis is resistant depression, not bipolar disorder. Fluoxetine is the backbone, and the role of lithium is to augment. There are other side effects of lithium on the baby other than the Epstein anomaly. And do not miss that the high dose of fluoxetine might affect the surfactant development and cause respiratory problems. Are you with me, doctor? Because most of the candidates forget that. Okay. So most of the candidates forget that this patient is also taking high doses of fluoxetine. They only focus on lithium. Number two, they forget that the diagnosis is resistant depression, not bipolar disorder, and the role of lithium here is to augment the effect of fluoxetine. Okay, so how we can do this station? Definitely you should show empathy in the beginning. He will express his worries, and one of your important points which you should mention here is the task is to address the concerns. You must mention that during the pregnancy, up to 80%, there could be a chance of relapse, okay? Because this is the statistical figure which is related to the mood disorders with the pregnancy. So taking medications is of utmost importance in the condition of a lady who is pregnant and she has a history of mood disorder, particularly if there is high risk. Okay, so this is one of the most important points which you should talk when you start talking about the concerns regarding her condition if she gets pregnant. So the relapse, you have the Epstein anomaly, okay? And also you have the effect of fluoxetine on the lung because she is on high dose of fluoxetine. It affects the surfactant. Are you with me, Dr. Lina? Okay, so these are the main points or the main important problems related to this lady who wants to get pregnant. The relapse, the effect of lithium, and the effect of fluoxetine. So is it going to have these side effects? Now, related to the lithium one, pay attention to these figures, very important. These are very important figures. Though there is a new talk that these figures are not very accurate and lithium is safe, but up till now, what is written in the new papers and the researches is different from the guidelines. So the guidelines still adopting this concept that lithium is not safe in pregnancy. So this is what you are going to do. This is not a lecture about lithium. This is a practical clinical situation. So in your clinic, you are going to apply the guidelines. And also you're going to apply something which will help you if there is any medical or clinical problems or legal problems. So if this lady developed any side effects, you don't want to be responsible for these side effects. So we must remember these figures that lithium causes increase in the side effects in general. 1 in 10 of the babies will develop malformation, and all malformations are increased by 3 times, and the risk of heart problems is increased by 8 times. Epstein anomaly is increased by 10 to 20 times. Okay. Okay, so 1 in 10 of the babies will develop malformation. Lithium by itself increases the malformations by 3 times, and the risk of heart malformations in general, not only Epstein, is increased by 8 times. Epstein anomaly itself is increased 10 to 20 times. Are you with me, doctor?
Yes, but I have, a little question. So I have to explain all of these figures to the co-patient?
Yes, you must mention them.
Yes, I have to
That
mention this.
lithium increases the malformations by 3 times, the heart by 8 times, Epstein. These figures you must know by heart. Lithium is a all-in-one rule, doctors. I don't know up till now. Lithium for the examiners in general is a parameter or a thermometer for the candidates, whether they know psychopharmacology or no. So it is sacred somehow, I don't know. So all the information you should know about lithium, you should know the side effects, the statistics, and so on. And as you can see, if you have a look at the figures, it is not difficult. So if all the mothers who are taking the lithium, their kids will have risk of 1 in 10. Okay, and lithium by itself increases all types of malformation by 3 times, the heart malformations by 8 times, Epstein, which is the most important, 10 to 20 times. Is the risk the same over the pregnancy? No, particularly the 3 months of the pregnancy are the most important. Can the mother breastfeed? All these are the questions which you are going to get in the car, in the station. Lithium is secreted in the milk in considerable concentration. She should not breastfeed. One of our friends has been taking lithium, and this is a very important question, and the candidates find it difficult to answer. Please pay attention to the following. Now, the risk of development of the side effects is not 100%, but because of the severity of these side effects, it is not recommended that the mother take the lithium, but it is the decision of the couples whether to take the risk or not. So somehow your answer was not wrong. Okay, so how we are going to help this lady? Before helping her, you must understand the biopsy again, doctors. You must say it clearly before formulating the management plan. I would like to know more information about your wife in order to formulate this suitable management plan. You want to know psychological information, medical information, social information, level of risk. Okay, whether she has been admitted before, any concern regarding her mental health now, how is her mood, okay, what about her medical condition? You don't know if she has any medical problems, is she taking any medical medications, what about her social circumstances, any stressors, any support around her, any concerns about her safety. As you can see, these are questions which will not take from you more than 20, 30 seconds maximum, but very important to show to the examiner that you understand that your management plan should be tailored according to your patient. I want to know the particular information about this patient, which will help me to set the management plan for this patient, not talking about in general how to manage a patient who is taking lithium and she wants to get pregnant. This is not a lecture, okay? Formulation, as I said, I'm not going to go through the formulation. You must do your formulation before talking about the management. Now, the management, as we said, the first point is to talk about where the patient is going to be treated and what are you going to do, Dr. Lina, and where the patient is going to be treated, okay? You want to talk to her and explain her management plan, address her concerns. Because the depression is controlled, she will be treated at home. However, during the pregnancy and the period after the pregnancy, the chance of relapse is high. There will be a nurse who will follow her up, and there will be a frequent follow-up in the clinic. And at any time, if the risk is high, the admission to a mental hospital will be considered. Okay, so this is to answer about the answer where the patient is going to be treated and what are they going to do. Investigations, very important to talk about the investigations, and don't forget the lithium level. Okay. Now, when we Say this sacred sentence. There will be a team who will follow her up and cover all her needs, physically, psychologically, and socially. Very important to say this sentence. Physically, very important because you need to liaise with the obstetrician. Okay. This lady cannot have a delivery without being planned because she needs to stay in the mother and baby unit after the delivery. Okay, psychologically, very important to mention that there is high risk of relapse associated with the pregnancy. That is why it is very important to take the treatment. However, there are different options. Each one has its own pros and cons. The fluoxetine is the backbone of the treatment, safe on the baby, but because of the high dose, the baby will need to stay in the mother and baby unit to make sure that the lung is not affected. So this is for fluoxetine. What about the lithium? The first option is to gradually decrease lithium before getting pregnant, then restart it again after 3 months while keeping it in the lowest level. Okay, the dose of lithium will change during the pregnancy because of the change of the body fluids. Are you with me, doctor? So this is the first option. Stop lithium, reinstate it after 3 months. Because of the change of the body fluids, the dose of lithium will be changed accordingly. Okay. Now the second option is to stop lithium during the pregnancy totally. This will be safe for the baby, however, carries risk on the mother and the relapse of depression. The third option is to continue taking lithium in the smallest dose, targeting the lowest therapeutic level in the blood. This option will prevent the relapse, but it carries the risk of developmental problems. Are you with me?
I am all ears, Dr. Hussam.
So these are the 3 options for the lithium. As you can see, you can take screenshots. This will help you to talk about the medications. So when you talk about the medications and management plan, start by talking about the perinatal team, the physical need to, you must liaise with the obstetrician, very important psychologically. You must mention that there is high chance of relapse. This lady needs to take medications, okay, and fluoxetine will not be stopped. It's safe on pregnancy. The lithium has 3 options as we have mentioned. And share with him leaflets, okay? Okay, doctor. I hope that you find it helpful, doctor. Thank you so much.
Very helpful. Thank you so much, Dr. Hussam. Thank you.
Okay. Who would like to go next?
Me, Dr. Basant.
Okay. Dr. Basant, just can you...
Metabolic syndrome.
Okay, so... Okay, if you do not prefer to open your camera. So
Yeah.
I will share the metabolic syndrome.
I'm ready, doctor, if you are ready.
Okay. Let's say that
Mr.
my name is
Mr. Richard, or
yes,
what?
Mr.
Oh,
1, 2, 3, 4.
hello, Mr. Richard.
Hello.
This is Dr. Basant from the mental health unit. How are you?
Well, I'm a bit worried because this is the first time to be asked to talk to a doctor after receiving my investigations. I want to know what's going on, doctor.
Yeah, I understand. So I understand from the notes that you have some concerns with your health and you got some blood tests. Are
Yes,
that right? Is it
yes,
right?
yes,
Okay. Okay, and are you happy to explore your blood tests with each other?
yes, no problem.
Okay, your blood test shows that you have like an elevated blood sugar, also might be something called cholesterol. It's unhealthy fat, it's quite elevated.
Yeah.
And also it show increased blood pressure and waist circumference. Are you
Well,
following me so far?
I'm worried. What could be the reason for these results, doctor?
Yeah, it seems that you have something we call metabolic syndrome. Have you heard about it
No,
before?
what is this metabolic syndrome?
Okay, it's a set of symptoms include elevated blood sugar, increased weight, and elevated blood pressure, also increased the unhealthy fat. And we know this could be a side effect of some medication, like clozapine.
I see.
And that's, yeah, that's because it interferes with body how to process food. Does it
I
make
see.
sense?
I understand. Is it serious, doctor?
Yeah, if not managed properly, yeah, it can cause serious side effects like some heart problems or may affect blood vessels, may
I
also
see.
make a diabetes and increase the blood pressure. Yes.
And what could be the reason for this metabolic syndrome?
No one can know for sure what caused it, but maybe in your case, clozapine is the cause for it.
I see.
But
So,
I just want to ask you a few questions for a better understanding of your situation.
okay.
Okay, doctor. So, what about your physical health? Do you have any physical health problems?
No.
And you don't take any medication?
Other than clozapine, no.
Okay, and I just wondered, do you have any family history of heart problems?
No.
And what about diabetes and hypertension?
No.
And what about obesity? Maybe it run
Well,
in
my
your
mother was
family?
obese as well as my father, but I don't recall that they took any medications.
Okay. And I know from my notes that you are diagnosed with schizophrenia. Is that right?
Yes.
And are you taking your medication clozapine
Yes,
regularly?
and it is helping me very much, yes.
And are you feeling you are stable in it?
Yes, very good.
Okay. Now I want to ask you some questions about your physical activity. Are you training, go to gym,
Okay. No,
something like
I'm
this?
a computer technician. Most of the time I'm sitting down. I don't do any physical activities actually.
Okay. And are you the one who love fruits or sugars and snacks,
Well,
fruits and
actually,
vegetables?
I'm not very keen to
Ah,
eat healthy. I take the just eat whatever is feasible on the takeaway menu. Most probably, I also drink fizzy drinks and so on.
yeah, I see. And what about your work?
As I said, I work as a computer technician. Most of the time, I'm sitting down.
Yeah, okay. And I just wondered, was all of this going through? Are you having any dark thoughts about ending your life?
No. I don't have any thoughts so far. So
And do you have any other stressors?
no.
And what about support? Do anyone support you?
Yes, I have my family living with me.
Okay. Now, I want to summarize quickly from what you told me. You have presented with increased blood pressure, weight gain on the background of schizophrenia that's controlled by your medication and maintained by not having like a healthy lifestyle. The good thing you are here seeking for help. We have a holistic approach from medication, psychotherapy, and also social aspect of care. Which one you want me to take you through?
Well, thank you. As you wish.
Okay, we can start with like medication. I want to, or your physical situation. I want to discuss your condition with GP, maybe for adding some blood sugar or lipid lowering agents. And we need to check your blood pressure regularly, as we can diagnose hypertension from one
1
session.
minute remaining.
And it's not good to change clozapine, as I know you are stable in it.
Okay, yeah.
And it's working good for you. And the main bulk for us is to having a healthy lifestyle. What about linking you to a dietitian?
Well, I don't have any problem with that.
Okay, and we may arrange a physiotherapist appointment for a personalized scheduling for you.
Okay.
And I want you not to forget the importance of staying away from stress and having a good sleep.
Okay. Thank you.
Thank you.
Time. How do you feel
Okay.
about what you did? It was good, by the way, but you need to be more fluent. Okay.
Yeah.
That's it. But
By the
everything
way,
you have addressed everything. Your explanation
just
for
the second time for me to practice.
Okay.
It's only the second time for practice.
Very good, actually. Metabolic
Thank you.
syndrome, actually, the explanation of the metabolic syndrome is cumbersome for the candidates. It is a disturbance in the metabolism of the body which cause changes in the blood chemistry and increase the blood sugars. Also, there is a change in the energy consumption. Okay, so the blood chemistry is changed and the patient becomes overweight because of these changes in the energy consumption. Okay. Everything related to your performance was good, except that in the beginning I tried to show you that I'm anxious. Show empathy, please. Doctors, in every station, there is a challenge for your communication skills, and in every station, the mark sheet contains 6 points to cover your communication skills. So the whole mark is 12 points. 6 of them are related to your communication skills. So don't underestimate this. So if you have any any role player who is anxious, worried, or particularly in the very first 1 or 2 minutes, show your communication skills, show that you understand what he feels and address it. Okay, show empathy, that's to say. But everything was good. I don't have anything other than this. Thank you so much, Dr. Besant. Excellent.
Thank you.
Who would like to go next? Have we finished? Who would like to go next? You're welcome.
Yeah, I can go next.
Okay. What is your name, Doctor?
I'm Viva Fejero.
Dr. Viv, yes. What is your station, Dr. Viv?
I
You
think I
said
was
that you're
Lewy
going to
body
do
hallucination.
Yes. Lewy body dementia with visual hallucinations, yes. As I said, the Lewy body dementia is like the anorexia nervosa high stations, lot of points to be covered, many domains to be covered in the management. So pay attention to it, okay? Okay, it is. Ready?
Yeah. There's no name for the son and there's no name for the father.
Yes, let's say my name is Mr. Brown and we are talking to Martin. My name is Martin and the patient's name is Mr. Brown. Okay?
Okay, okay. Hello, Martin.
Hello, doctor.
Okay. Yeah, my name is Dr. Siagoro. I'm one of the doctors here. I understand you are here to talk about your father, Mr. Brown.
Yeah, he's is my stepfather. Actually, he has changed a lot recently.
Mm,
He's not sleeping properly. He's talking to his
mm,
wife who has died 10 years ago. And
mm,
sometimes he is confused. He doesn't know the place. He doesn't know us. Yesterday, he wandered outside and the police brought him. And I would like to know what's going on.
yeah. I'm so sorry to know about the difficulties your stepfather has been going through. And yes, like you said, we've noticed some changes in his memory. Yeah, and also he has been acting like he's confused, and also has been having what we call visual hallucination, like you just explained. He has seen things that are not real. And putting all this together, we also did a scan of his brain, and the scan showed some findings that are in keeping with a certain kind of dementia. Are you with me so far, Martins?
Yes, we know that he has been diagnosed with Lewy body dementia.
Yes,
He's been
yes.
following up with the memory clinic for 6 months now.
Okay,
But
okay.
lately, in the past 1 month, everything has been upside down.
Mm, mm. And did anything happen recently that caused these changes?
Well, nothing in particular. He had these movement problems about 2 months ago, and the neurologist adjusted the dose. And actually, it managed properly his movement problem. But now I don't know. The neurologist said that this problem is not from my side. We should talk to you.
Okay. Well, actually, Lewy body dementia is a slowly progressive condition. Okay, so usually after diagnosis with some people, sometimes it slowly progresses. And right now, your stepfather, Mr. Brown, is on a medication called rivastigmine. Are you aware of
Yes,
that?
yes,
Okay.
I know that he is on rivastigmine. Yes.
Okay, so with that medication, what it does is to help improve the quality of life and reduce the deterioration. But with him still having this deterioration, there are some things we could do for him. I'm wondering what exactly is your concern at this time?
Well, I don't know he has been doing fine for the past 6 months, and now we cannot help him because I'm out of and me and my wife are out of the house most of the time.
Yeah. Okay, so who supports him when you and your wife are out of the house?
Well, no one. That's why he went out and he got lost and been brought by the police.
Okay. And are you able to cope with caring for him?
Well, nowadays, no.
Okay. And do you think you want support to help care for Mr. Brown?
Well, that's why I came here to discuss how we can help him.
Okay. Yeah, I see that it seems like there are difficulties with his care right now. There are a lot of options we could have for it to help him. One of this is that we could think of helping him like with a supported accommodation, okay, so that he can have support 24 hours of the day. What do you think about that?
Well, I don't have any problem. This will help him.
Sorry, you don't have a problem if what?
Excuse me?
Sorry, what did you just say? I didn't get what you just said.
I said I don't have any problem. This will help him.
Okay, all right, that's good. I can discuss with the team and we can see what we can do about that. And apart from that, also, we can also introduce your father, okay, your stepfather to support groups with those who have Lewy body dementia, and they can also support him. Is that okay?
Okay.
Okay. And would you want me to talk about medication options to help him?
Yeah, this will be helpful. Yes, definitely.
Okay. So he's on rivastigmine 3 milligram right now. Another thing we could do is to increase the dose. So it can go up to about 6 milligram. And we hope that could help him. What do you think about that?
Well, I don't have any problem, doctor. This will help him.
Okay, all right. We can think of increasing his dose. And also we might have to just book an appointment to see him, okay, just to know why he's having this deterioration. And because there are lots of factors that can come into play to affect him at this time. What do you think about that?
Okay.
Okay, we could assess him. Then we could think of doing bloods and think of doing a urine screen just to rule out an infection going on. What do you think about that?
Okay, doctor.
Okay, yeah. Is there anything else that's on your mind that you want to ask about?
No, thank you.
Okay, I just want to check, okay, with all this happening to him, has he voiced any thoughts to harm himself?
No voices. So maybe
Okay.
just
You
talking
said,
with someone else.
okay. And before we assess him, are you able to keep him safe?
Well, I don't know if this is feasible with the current condition, but
Okay, that means we'll have to arrange an assessment as soon as possible, urgently, just because of risk. And you also mentioned he has been wandering out of the house, right?
yes, it's one.
Okay. All right. We'll book an appointment and see him urgently so that
1
we can
minute
put up his
remaining.
files also into place. Do you have any more questions?
No, thank you. No, thank you.
Yeah. Is there anything else you want to say, Martins?
No, thank you.
Okay, thank you so much. I could give you a leaflet just to read more about Lewy body dementia.
Okay.
And also, we are here and anytime you have any worries about your father.
Okay, thanks.
Thank
How do
you.
you feel about what you did?
I don't know. I was a bit distracted here. I was a bit disorganized, but I was just trying to manage the patient.
Well, I feel that
Yeah.
you do not have enough time to prepare for this station. There are a lot of considerable amount of points which you should cover in this time, in this station. So the first thing which you want to know exactly is what is wrong with your patient. Okay. Definitely in the beginning you should show empathy, but then you want to know exactly what is wrong with this man. So you're going to have rapid assessment regarding his biopsychosocial domains and level of risk. This is your start. You want to know exactly what is the psychological level. So when you take these information, you understand that his psychological level deteriorated 1 month ago, and this is associated with the change in the level of levodopa. Are you with me, doctor? Okay, so with the change of the level of levodopa, he started to have these psychological problems. He doesn't appear to be depressed, but you must ask about the confusion, because if it is a confusion, a delirium, or a medical problem, this is considered to be an emergency. And it is what makes it different from the other, from the confusion associated with the medication, is that the patient's physical condition is stable and the patient's delirium or confusion is temporarily. So this is what makes the confusion of the Lewy body dementia or the confusion resulting from the medications different from a confusion from the general medical condition. If it is a confusion because of the general medical condition, there will be an underlying severe medical problem affecting the cognitive functions. Number two, it is not a temporary condition, rather it is a continuous condition. Okay, so very important in the very first beginning to know more about his physical, psychological condition, particularly the condition of the confusion. Now, physically, you want to know what about his physical condition and the movement, because usually these patients who are taking the, who have Lewy body dementia are also taking medications related to the movement to correct the movement problem. And these medications doses should be accurately adjusted according to their condition. Otherwise, they will go through side effects. And this has happened in this, and this is what happened in this station. Number three, the social condition of the patient, because as you can see, this patient is very independent. He needs a lot of support. So you want to know exactly what's going on. Number four, the level of risk. And as I mentioned, that the patient already was wondering, so you want to know more about this issue. What could be other risk elements in the condition of the patient? Okay, so this is how you start your station. You want to know more about your patient. Ask about the biopsychosocial domains and the level of risk. When you ask these questions, you will understand what's wrong with the patient and you will have a complete picture. The second point is the explanation. And by the way, these are the points which we go through while we are doing our management plan. So your first point is the introduction. Number two, gathering the biopsychosocial information. Number 3, the explanation. Number 4, the formulation. Number 5, the management. So now we are in number 3, the explanation, that this man is having Lewy body dementia. Okay, and these symptoms can be due to the changes in the doses of the medications and could be also a delirium because of a medical problem. Okay, are you with me, doctors? The symptoms can be due to the medications, can be due to the Lewy body dementia syndrome itself. It is associated with confusion and is also associated with hallucinations. Or it can be due to a medical problem causing delirium and confusion. Okay? How we can help him? So before going through how you can help him, he must formulate. Unfortunately, Dr. Viv, you did not formulate. Please pay attention to this skill. You must formulate, as I said. The first point to be scored for you is the formulation, as you can see. If you don't know how to formulate, if you don't know how to pick the important points which you are going to work on in your management plan, most probably you're not going to pass, because definitely you would set a wrong management plan, because the formulation is the foundation of your management plan. So when we talk about the management, as I said, you'll only have 90 seconds. You must be very organized. The first point is, what are you going to do, Dr. Viv, and where the patient is going to be treated? So you must talk to the patient himself and assess his mental and physical condition and address his concerns. Very important to say this, as I said, there is a point for the doctors who talk to their patients. Okay? And where the patient is going to be treated, this depends according to the care assessment, the level of support where the patient needs. So if there is good support at home, most probably the patient is going to be treated at home. Otherwise, he's going to be placed in a nursing place. Okay. You need to do investigations to exclude any underlying medical condition. Now, the sacred sentence, there will be a team who will take care of him physically, psychologically, and socially. But you must liaise with the neurologist and the GP, because the GP must manage the hypotension. The neurologist must adjust the dose according to the patient's diagnosis, because if there is an increase in the dose, the patient might go through the hallucinatory condition which the patient is in right now. Psychologically, okay, the patient is going to take the rivastigmine. When you talk about the rivastigmine or any medication in a patient who has memory problem, you must talk about patches and Z-boxes. Talk like a professional. You don't just throw the names of the patient of the medications. This is a patient who has dementia. He will forget taking his medications, so you need to put his medications in a form which will help him to take its medication, like the patches or the Z-boxes. Very important to talk about the social part. There will be a care assessment, either to sort out a care package or to place the person in a nursing home, and there will be an occupational therapist. Very important to talk about the occupational therapist because of the movement problem and to make sure that the environment is safe. As you can see, doctors, there are a lot of points to be covered in the Lewy body dementia. That's why it is difficult to pass. Please prepare these types of stations very. Thank you so much, Dr. V.
Thank you, Dr. Isaac. Please, can I just get a screenshot of the task again, please? Sorry, it's my face.
Screenshot of what?
Is the task, like the station I just did now, please. Thank you.
Okay, then let's start from the beginning. This is the station itself. Okay, take screenshot.
Yeah, I've gotten it now. Thank you.
If you don't want, okay, you don't want to take the rest, you know.
Okay, yeah, I will. Thank you.
Okay.
I got the rest. I got the rest. It's okay. Thank you, Dr.
Okay.
Stan. Yeah.
So who would like to go next? But please be prepared. I don't want to go through station with anyone who is not prepared for station.
And do elderly mania.
Okay, who's talking?
It's still Viv.
You want to do the elderly mania? Did you
Yeah.
prepare it? Because I felt that the last station you did not prepare it, actually. Did you prepare it? If you did not, please next time prepare.
I'll prepare next time, Dr. Hussein.
Okay, what?
I'll prepare next time.
Okay. Okay, who would like to go to do next, please? Okay, I hope that you found it helpful. I will put the record of this session on my YouTube, and also I will put the formulation clip on the group. Thank you so much, doctors. Hope to see all your names in the pass list. I hope that you found
Thank
it
you.
helpful. It was a
Thank
pleasure and privilege to be with you. Have a good night. Thank you so much.
Thank you. Thank you, Dr. Hassan. Barakallahu feek.